In the US, 1/3 of adults suffer from hypertension, also referred to as high blood pressure, and fewer than half of those individuals have their blood pressure under control. Severe health issues can arise from high blood pressure without any prior warning symptoms. You run the risk of developing heart disease, stroke, kidney damage, or aneurysm formation when your blood pressure is too high for an extended period of time. You might be wondering if taking medication is necessary to lower your blood pressure if it is high. However, modifying one's lifestyle is essential for managing high blood pressure. Maintaining a healthy lifestyle and controlling blood pressure can help avoid, postpone, or minimize the need for medication. These 10 lifestyle modifications can both reduce and maintain blood pressure. Lose extra pounds and watch your waistline. Weight gain is often associated with elevated blood pressure. Additionally, being overweight can lead to sleep apnea, which is a disorder of breathing during sleep that elevates blood pressure even more. One of the best lifestyle adjustments for lowering blood pressure is losing weight. Even a modest weight loss can help lower blood pressure if you are obese or overweight. Blood pressure may generally decrease by approximately 1 millimeter of mercury for every kilogram, 2.2 pounds, of weight lost. Additionally, the waistline size matters. High blood pressure risk can be increased by obesity around the waist. Generally speaking, if a man's waist measures more than 40 inches, 102 centimeters, he may be at risk. If a woman's waist measures more than 35 inches, 89 centimeters, she may be at risk. Different ethnic groups have different numbers. Find out what a healthy waist measurement is for you by asking your healthcare provider. Exercise regularly. Approximately 5 to 8 millimeter mercury can be lowered from high blood pressure with regular exercise. In order to prevent blood pressure from rising again, it's critical to continue exercising. Aim for at least 30 minutes a day of moderate physical activity as a general goal. Additionally, exercise can prevent high blood pressure or hypertension from developing from elevated blood pressure. Frequent exercise can lower blood pressure in hypertensive individuals to safer levels. Aerobic exercises such as walking, jogging, cycling, swimming, or dancing can help reduce blood pressure. High-intensity interval training is another option. Short bursts of intense exercise are interspersed with slower intervals of activity during this kind of training. Additionally, strength training can lower blood pressure. Make an effort to work out with strength training at least twice a week. Consult a medical professional about creating an exercise regimen. Eat a healthy diet. Up to 11 millimeter mercury can be taken off of high blood pressure by eating a diet high in whole grains, fruits, vegetables, low-fat dairy products, and low in cholesterol and saturated fat. Dietary approaches to stop hypertension, DASH, and Mediterranean diets are two examples of diets that can lower blood pressure. Dietary potassium helps mitigate the blood pressure-raising effects of salt, sodium. Foods like fruits and vegetables are the best sources of potassium, not supplements. Aim for 3,500-5,000 milligram daily, as this may result in a 4-5 millimeter mercury drop in blood pressure. Find out how much potassium you should consume from your healthcare provider. Reduce salt, sodium in your diet. Reducing sodium consumption even slightly can have a positive impact on heart health and lower high blood pressure by 5 to 6 millimeter mercury. The impact of sodium consumption on blood pressure differs between demographic groups. Generally speaking, keep your daily sodium intake to 2,300 milligram or less. For most adults, though, a daily intake of 1,500 milligram or less of sodium is ideal. To cut back on sodium consumption, examine the labels on food. Seek for foods and beverages that have reduced sodium content. Reduce your intake of processed foods. Foods only contain trace amounts of sodium by nature. Processing adds the majority of the sodium. Leave out the salt. Use spices or herbs to give food flavor. Cook. You can regulate the food's sodium content by cooking it. Limit alcohol. Reducing alcohol intake to less than 1 drink per day for women and 2 drinks per day for men can help lower blood pressure by approximately 4 millimeter mercury. This is one way to reduce sodium in the diet. 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof liquor make up 1 drink. However, excessive alcohol consumption can cause blood pressure to rise several points. Additionally, it may lessen the benefits of blood pressure drugs. Quit smoking. Smoking increases blood pressure. Stopping smoking helps lower blood pressure. It can also reduce the risk of heart disease and improve overall health, possibly leading to a longer life. Get a good night's sleep. Less than 6 hours of sleep per night for a few weeks is considered poor sleep quality and can lead to hypertension. Many conditions, such as sleep apnea, restless leg syndrome, and insomnia in general, can interfere with sleep. If you frequently have problems falling asleep, let your healthcare provider know. Sleep can be improved by identifying the cause and treating it. But if you don't have RLS or sleep apnea, try these easy sleep hacks for a more peaceful night's sleep. Maintain a sleep routine. Set a daily routine for when you go to bed and wake up. Attempt to maintain a consistent routine on weeknights and weekends. Make a peaceful environment. This calls for maintaining a cool, peaceful, and dark sleeping area. Spend the hour before going to bed doing something calming. This could entail practicing relaxation techniques or having a warm bath. Steer clear of bright light sources like computer or TV screens. Keep an eye on what you eat and drink. Avoid going to bed full or hungry. Aim to avoid heavy meals right before bed. In addition, limit or stay away from alcohol, caffeine, and nicotine right before bed. Limit your naps. Restricting naps to 30 minutes early in the day may benefit people who find that naps during the day help with sleep at night. Reduce stress. Chronic, long-lasting emotional stress may be a factor in elevated blood pressure. To determine whether stress reduction methods can lower blood pressure, more research is required on their effects. Finding strategies to lessen stress and identifying the sources of stress, such as job, family, money, or illness, can't hurt though. Try this out. Don't try to take on too much. Prioritize your tasks and make a plan for the day. Acquire the ability to refuse. Give yourself enough time to complete the tasks at hand. Make plans to address the problems you can control and concentrate on them. Speak to a supervisor about a problem at work. Look for solutions to resolve conflicts with your spouse or children. Steer clear of stressful situations. For instance, travel at a different time or use public transit if rush hour traffic stresses you out. If at all possible, stay away from stressful people. Set aside time to unwind. Every day, set aside some time to sit still and deeply breathe. Allocate time for pleasurable pursuits or interests, like hiking, cooking, or volunteering. Show appreciation for what you have. Thanking people for their contributions can help lower stress. Monitor your blood pressure at home and get regular checkups. You can monitor your blood pressure at home with the aid of monitoring. It can confirm that the changes in your lifestyle and medications are effective. There are many readily available, non-prescription home blood pressure monitors. Before you begin, discuss home monitoring with a medical professional. Another essential component of blood pressure management is routine provider visits. Find out from your doctor how frequently you should get your blood pressure checked if it is under control. It may only be possible for you to check it once a day or less frequently. Get support. A supportive network of friends and family is crucial for overall health. To help you maintain low blood pressure, they might start an exercise regimen with you, drive you to the care provider's office, or encourage you to take care of yourself. Consider joining a support group if you discover that you require assistance from sources other than your friends and family. This could connect you with people who can support you emotionally or morally and provide helpful advice on managing your condition. That's all for today's video. Please hit subscribe to keep watching more content like this and share it with friends and family.